The spinal cord serves as the connection between the body and the brain. We have seen that this is protected by the vertebra, meninges, and contains cerebrospinal fluid. The meninges of the spinal cord are exactly the same, except there is a superficial space between the dura mater and bone called the epidural space. This space contains adipose tissue for some cushion, and we'll discuss reflexes later. The regions of the spinal cord match the regions of the vertebra. Here we see that in the cervical and lumbar regions, the spinal cord is a little thicker. These two spots are the cervical enlargement and lumbar enlargement, respectively. In addition to the regions, there are three specific structures noted here. The conus medullaris. This is the conical tip of the spinal cord as an intact structure. Think of it as the end of the spinal cord proper. Cauda equina, the portion of the spinal cord where individual tracts are separated. Again, think of this as the separation portion of the organ. And filum terminale, the extension of the pia mater that attaches to the coccyx. Think of this as the anchor for the spinal cord. This cross-sectional view shows us the adipose-filled epidural space, as well as the three meninges and subarachnoid space. We also see the spinal nerves entering the intervertebral foramen. And lastly, note the anatomic position of the spinal cord. This black line marks the anterior from posterior sides. Most spinal cord structures are named after their anatomic position and a key word. Let's review the key words, then find a landmark for anatomic position. Funiculus, the white matter tracts. Horn, the gray matter structures. Root, a branch of the spinal nerve inside the vertebra. Ramus, branch of the spinal nerve outside the vertebra. The landmark has a blue star on it. This structure is the dorsal root ganglion, and it is a structure of the dorsal root. Therefore, everything on this side is a posterior something. The dorsal root ganglion, that structure with the blue star. Here we find soma of sensory neurons. The dorsal root. This is the dorsal branch of the spinal nerve. Here we find central processes of the sensory neurons. Cut this structure, and you lose all sensory input at this region. Posterior funiculus, the white matter tracts on the dorsal side of the spinal cord. These are ascending and carry action potentials up to the brain. Posterior horn, the dorsal gray matter. Here we find soma of interneurons. Ventral root, the ventral branch of the spinal nerve. Here we find axons of the motor neurons. Cut this structure, and you lose all motor output at this region. Anterior funiculus, the white matter tracts on the ventral side of the spinal cord. These are descending and carry action potentials down from the brain. Anterior horn, the gray matter. Here we find soma of somatic motor neurons. Lateral funiculus. These are white matter tracts that are both ascending and descending. And lateral horn, gray matter that contains soma of autonomic motor neurons. You do not need to learn the individual tracts here. I show you the image to appreciate the very specific tracts of the spinal cord. Each is named after the two connected structures. Spinocerebellar is spinal cord and cerebellum. Do spend some time reviewing the layout of the spinal cord. When finished, you could use the Quizlet flashcards for review. Spinal nerves have the same structural features as cranial nerves. Note epineurium, fascicles, perineurium, and endoneurium. Sensory neurons are unipolar. The exceptions are eye, nasal mucosa, and ear, which are bipolar. Otherwise, sensory neurons tend to be named after their stimulus. Nociceptors detect pain. Thermoreceptors detect temperature. Chemoreceptors detect soluble molecules. Mechanoreceptors detect movement. These include position, proprioceptors, pressure, baroreceptors, and tactile, touch, pressure, vibration. Otherwise, all sensory information eventually travels on ascending posterior funiculi into the brainstem. They are relayed through the thalamus to the cerebral cortex, and you feel on that cerebral cortex. Sensory neurons travel on the same spinal nerves as motor neurons. We see the exact same regions as noted earlier. Off the cervical and lumbar enlargements, there are branched networks called plexes. Recall that rami are branches of the spinal nerve outside the vertebra. The rami separate the somatic from autonomic systems. Dorsal and ventral rami carry somatic, while rami communicantes will carry autonomic. Off the ventral rami of the cervical and lumbar enlargements, we will find the branch networks of nerves, plexes. There are 4 plexes, 2 off each enlargement. The cervical enlargement gives rise to the cervical and brachial plexus. The lumbar enlargement gives rise to the lumbar and sacral plexus. The cervical plexus innervates the neck, ear, back of head, and shoulders. One specific nerve, the phrenic, innervates the diaphragm. Because of this, damage high on the spinal cord can result in paralysis of the diaphragm and the inability to breathe. This is exactly what happened to the actor Christopher Reeves. He damaged his spinal cord in a horse racing accident above the cervical plexus. The brachial plexus innervates the superior appendage. The nerves listed here should sound familiar, and by the way, the ulnar nerve is actually your funny bone. The sacral plexus innervates the buttocks, inferior appendage, perineum, and also leg. The sciatic is often injured, so much so it's called sciatica. The pudendal nerve innervates the genitals, so that's interesting. A region of the skin innervated by a specific spinal nerve is called a dermatome. You can see a dermatome map here. They're used to determine affected spinal nerves with injuries. an application of dermatomes. With shingles, the virus is expressed on dermatomes and does not cross the body midline. This is one of the hallmark features of the infection. Now again, there are review flashcards for the required anatomy here. Time to switch subjects again. Reflexes are a rapid, predictable, automatic response to a stimulus. That means that our body responds the exact same way every single time. Because they help maintain homeostasis, it should make sense that the reflex arc diagram looks like the components of a homeostasis diagram. There are many, 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 many reflexes in the body, and we will touch on only a few. All reflexes can be classified in 4 ways. Monosynaptic means there's a sensory and motor neuron only and no interneuron. Therefore, there is only one synapse in the integration center. Polysynaptic has at least one interneuron in the integration center, so more synapses. Spinal travels on spinal nerves and synapses in the spinal cord. Cranial travels on cranial nerves and synapses in the brain. Somatic, the effector is a skeletal muscle. Autonomic, the effector is cardiac's smooth muscle or a gland. Ipsilateral, receptor and effector are on the same side of the body. Contralateral, receptor and effector are on opposite sides of the body. Stretch reflexes are ipsilateral and monosynaptic. These protect a muscle from being overstretched. The receptor is a muscle spindle receptor. When the muscle is stretched, the reflex is activated and the muscle responds by contracting to relieve the stretch. The patellar reflex is a stretch reflex. Just a diagram of how the receptor works when stretched. A Golgi tendon reflex is activated when a tendon is stretched. The result is the muscle connected to the tendon is forced to relax. These are ipsilateral and polysynaptic, and the receptor is a Golgi tendon organ. Here we see a diagram of the Golgi tendon organ within a tendon and a diagram of the reflex. This reflex is actually 2 that occur together. These are contralateral and polysynaptic. The result is flexion and extension of your arm or leg. Imagine walking across your kitchen floor. Your right foot steps on something sharp. Your right foot would pull away from the pain. That's flexion. At the same time, the muscles in your left leg contract to extend your hip, knee, and ankle so that they don't buckle when you shift your weight. That is the crossed extensor part. So here's a series of clinically important reflexes. Most are not in the learning objectives. This reflex changes with our developmental age. If an object is lightly scraped on the bottom of the foot, a newborn's toes should flex, as in the bottom picture. After a certain age, the response changes, and the toes should then curl, as in the picture with the key. The ankle jerk is similar to the patellar reflex. The pupillary is contralateral, polysynaptic, cranial, and autonomic. No notes here. There are tons and tons of reflexes in the newborn that change with developmental age. These are used by healthcare providers to assess the baby and see if it is meeting developmental stages. This picture shows some of those reflexes in action. And again, no notes here, but healthcare providers also use reflex results to hint at pathologies. Note the many associated with autism.